Picture this, someone wincing as they bend, rubbing their lower back after picking up a grocery bag, struggling with routine movements. If you've ever asked, "Why does my back hurt?" you're not alone. Over 80% of adults will experience lower back pain in their lifetime. It's the #1 cause of work-related disability and costs billions annually. But here's the silver lining. We have 11 proven science-backed strategies, everything from walking and core exercises to sleep habits and even advanced treatments, all validated by major research institutions like JAMA, NIH, Penn State, and WHO. These are not quick-fix gimmicks. They are methods rooted in peer-reviewed trials and pilot studies. If you're ready for real, effective, and safe solutions for your back and want to continue receiving research-driven health tips, go ahead and hit like, subscribe, and the bell. Your back and your future self will thank you. Let's jump into it. Understanding lower back pain. First, let's demystify why back pain happens. In about 85% of cases, doctors call it nonspecific, meaning there's no single identifiable cause like a fracture or inflammation, but it still causes real discomfort and disability. Worldwide, it's the leading cause of disability. Even though many people recover within a few weeks, studies show about 30% still experience moderate pain after a year. The good news is that, in most cases, lower back pain is biomechanical, related to movement patterns, posture, and muscle imbalances, and can be managed conservatively. Only about 1 to 10% of patients end up requiring surgery. Knowing this helps reduce anxiety, empowering you to tackle pain with exercise, lifestyle adjustments, and medical guidance, instead of panic or unnecessary procedures. Move more. Daily walking. One of the simplest yet most powerful tools against back pain is walking. A large Norwegian cohort study involving over 11,000 adults, published in JAMA Network Open, found that walking more than 100 minutes per day, about an hour and a half, was associated with a 23% lower risk of chronic low back pain compared to walking less than 78 minutes daily. Moderate to brisk walking added another 15 to 18% protective effect. The study used accelerometers to accurately measure daily steps and pace, with participants followed over 4 years of follow-up. Walking prevents stiffness, increases spinal mobility, nourishes spinal tissues through better circulation, and releases endorphins that boost mood and reduce perceived pain. Experts agree that combining total walking time with higher intensity segments yields the best results. To make walking easy and consistent, aim for multiple short walks, 5 to 10 minutes, throughout your day, gradually increasing toward 100+ minutes total. This approach is backed by similar findings summarized in Eating Well and Health Reports. Core strength and proper lifting. Strong core muscles are essential because they stabilize your spine and distribute forces during movement. Research consistently shows that exercises like planks, glute bridges, and bodyweight squats help reduce pain and improve function in chronic back pain patients. Proper lifting technique, keeping the spine neutral while bending at the hips and knees, is equally crucial. Contrary to common myths, it's not lifting heavy objects, but lifting with poor form and weak core that leads to injury. By building core strength and learning to lift mindfully, you can protect your back during everyday movements. Integrate simple exercises into your routine a few times weekly, focusing on controlled movement and spine alignment. Stretch and flexibility. Tight muscles, especially in the hamstrings, hip flexors, and glutes, can pull your pelvis out of alignment, straining your lower back. Studies find that gentle, consistent stretching of these muscle groups improves mobility, reduces tension, and eases pain. Check out PMC's stretch-related findings. Include stretches like seated hamstring hold, kneeling hip flexor stretch, piriformis stretch, and gentle spinal twists in your daily routine. While stretching, practice slow, deep breathing, what scientists would call diaphragmatic breathing, to help your muscles relax. Just 2 to 3 minutes of stretching can improve comfort and flexibility over time. Exercise therapy. Experts have reviewed over 300 randomized controlled trials on treatments for lower back pain, concluding only about 10% offer clear, lasting relief. Interventions with solid evidence include structured exercise programs, spinal manipulation by trained professionals, and taping. To maximize results, a multimodal approach works best, combining core strength, walking, flexibility, spinal techniques, and relaxation strategies. If you're under the care of a physical therapist or physician, coordinated methods yield significantly better outcomes. Pain relief physical aids. Over-the-counter anti-inflammatory medications can reduce pain during flare-ups. Absolutely include, however, they come with potential stomach, kidney, and cardiovascular risks. Absolutely include, so by applying superficial heat like a warm pad to the lower back can relax tight muscles and increase blood flow. Absolutely include, can't see a therapist. Absolutely, a one-time therapeutic massage or spinal manipulation may also help temporarily, but only when combined with targeted exercise and longer-term strategies. Relaxation techniques and psychological approaches. Stress, anxiety, and sleep problems intensify pain perception. Techniques like diaphragmatic breathing, body scanning, and grounding while walking can reduce muscle tension and improve how you cope with discomfort. Clinical trials, including an RCT with 342 participants, have shown that both relaxation techniques and cognitive behavioral therapy, CBT, result in greater pain reduction and functional improvement after 26 weeks. About 60% achieved meaningful improvement compared to 44% in usual care. That effect persisted at 52 weeks. You don't need a classroom, just 5 to 10 minutes daily of simple breathing or guided relaxation, especially during pain flares. Sleep and lifestyle. Sleep plays a major role in back health. Poor sleep worsens pain and disrupts healing cycles in the body. Research links inadequate rest to heightened pain sensitivity. To support recovery, maintain a stable sleep schedule, including weekends. Sleep in a cool, dark bedroom, use a supportive pillow and mattress, and limit screen exposure at least an hour before bedtime. Getting morning sunlight helps regulate your internal clock, improving sleep and reducing pain over time. Nutrition, smoking, and alcohol. Spinal health benefits from a systemic whole-body approach. A diet rich in fruits, vegetables, lean protein, and omega-3 fatty acids helps reduce inflammation. Smoking interferes with spinal blood flow, delaying tissue healing and increasing chronic pain risk. Excess alcohol disrupts sleep and recovery processes. By adopting a balanced diet, quitting smoking, moderating alcohol, and maintaining movement, you support your spine's resilience from the inside out. Informative Ergonomics and Biofeedback technology. At work or home, spending long hours seated strains your back. Investing in an ergonomic chair, a properly set desk, or even alternating standing and sitting can reduce spinal stress. Tech has stepped in too. Wearable posture trackers and soft supportive exosuits have been shown to reduce muscle load by about 30%. Combine tools like posture alerts, regular movement breaks, and deep breathing to reinforce spine health. Red flags and when to see a doctor. While most back pain is manageable, certain symptoms require immediate medical attention. You should see a doctor right away if you experience new numbness or weakness in your legs, bladder or bowel control issues, fever or chills, night sweats, or unintended weight loss. These could indicate serious conditions such as spinal infection, inflammation, or cauda equina syndrome. For routine back discomfort without these red flags, however, practicing the self-care strategies we've discussed is often sufficient, though consulting a healthcare provider is always wise. To sum up, these 11 scientifically validated strategies, from walking and core exercises to relaxation techniques, sleep improvements, lifestyle changes, and even advanced medical options, are supported by clinical research and decades of data. The key to healing is consistent practice and, when necessary, medical guidance. We'd love to hear from you. Comment below and share which methods helped you. Don't forget to like, subscribe, and ring the bell to join our community and access more science-based health insights. And also, feel free to contact us for a free second opinion or visit the website for more information. That's it, guys. Take care of your back and each other. See you all in the next video.